Mental illness touches so many lives, and the ways people manage and heal can be so incredibly diverse. Symptoms of depression, anxiety, PTSD, for example, can be manifested emotionally, physically, and socially. Each person has her own individual story and her own cultural background that shapes her journey. Traditional medical modalities like therapy and psychiatric medications alone are so helpful for many, but for others, they have to find something outside the traditional medical environment, working with alternative and complementary approaches that exist beyond or alongside the medical system may in fact be the best choice for them. Science is beginning to explore the efficacy and safety of some of these non-traditional approaches in order to expand options for all those who are struggling. The intersection of trauma and mental health, race, gender, identity, class, and geography impacts access and treatment options. So the exploration of all healing modalities is so important and relevant to the vast numbers of women struggling with mental health in today's world. Welcome to Gyno Curious. I am your host and creator, Dr. Amy Novat. From both sides of the speculum, we're here to investigate what it means to be a healer and to be healed. Please send your questions, concerns, thoughts to comments at radiofreerhiniecliff.org. And if you're interested in my clinical practice, whether in person or virtually, please go to dramynovat.com, and all the information is there. So today I am so thrilled to be speaking with Taylor Harris. Taylor is a licensed professional clinical counselor. She earned her master's degree in clinical mental health counseling and is trained in EMDR, trauma-informed relational somatics, ketamine-assisted psychotherapy, and the Gottman method. Welcome, Taylor.
Oh, hey, Amy. Thank you so much for having me.
It's so nice to see you. You are on the other side of the country, right? You're in LA?
Yep, I'm in LA.
Great.
Yeah.
So I like to begin Gyno Curious with just talking about people's kind of professional/personal arcs. Like, how is it that you decided to work in mental health? Was it something that you've always thought about doing, something that evolved out of personal experiences? Can you share that with us?
Yeah, great question. For me, I've actually done a lot of reflecting on this recently. So this is great timing for this question. I think I've always been fascinated by all things human experience. I think from a very early age, I was curious as to why humans do the things they do. I also historically in my family lineage was never given a lot of context as to what was happening. So I think I was left to sort of fill in the blanks a lot of the time and to sort of read the room in terms of what was happening in my environment. And then I also had very early exposure to therapy. So throughout my childhood, teenage years, and early adult life, I had spent a lot of time in that room and in that space. So I had a variety of experiences in that part of my journey. Some therapists whom I really connected with, others who maybe I first experienced some sort of rupture. So that sort of gave me a great foundation of understanding what that space was about. It was very supportive and beneficial for me, and then also showed me some of the pitfalls as well. And then, yeah, my fascination sort of evolved into this realm of human consciousness. And I'm like, okay, if it's not just behavior, what else is going on here? And so I really, pivoted and directed my studies towards more of that.
Yeah.
And here I am.
Great. It's so interesting how those early experiences teach us. I mean, I know that sounds simplistic or obvious, but I do love hearing people's arcs, because so often what feel like things that are really divergent, in fact, converge and crystallize pursuits. Other times when they're divergent, it kind of the repulsion, if you will, the plus minus magnet, it's they learn from that as well. So as you describe as a young person in those therapeutic environs, some of which were positive and some were not so positive, and both were teachers.
Yeah, definitely. I guess there could have been that moment there, sort of in the divergence, right? Where I was like, screw this. This is not anything I want to do. But instead, I think I leaned into it a bit more and I was like, no, there's something here, even though this didn't go as I had planned or didn't feel very good.
Right, exactly. Yeah. Which I think is so much a part of the therapeutic process for folks, is understanding, or at least my experience is understanding that sometimes the things that make us feel most uncomfortable are in fact the places we need to go. And again, that may sound obvious, but when I talk to women in my practice and talk to them or recommend that they see a therapist, just like they're like, too hard. I don't want to upset the cart. And I'm like, well, that's exactly what needs to happen for change to occur. Yeah. So, what I'm so impressed with is when I've had the pleasure and privilege of speaking to several guests on Gyno Curious who are in the mental health field. And what I've observed is that so many clinicians have kind of an array of modalities, as described in your bio, the EMDR, the trauma-informed relational somatics, the ketamine-assisted psychotherapy, etc. How did you arrive at your kind of particular healing toolbox? How do you and your peers evolve in that way?
Yeah, I think when I was in graduate school, my first internship was in an inpatient rehabilitation center. So I did my internship there while I was in graduate school and then also stayed on board through my associateship. So I was receiving supervision and collecting my hours there. And I really loved the team that I was working with there. I believed like wholeheartedly that everyone's intentions were in the right place and we were a great cohesive team. But it also, you know, gave me more than a window. I was going to say a window into, but I was sort of thrust into this whole world that is the mental health industrial complex of rehabilitation centers, right? And I was learning more and more about how certain approaches just don't actually work. And more, I was becoming more aware of the focus being primarily on the mind in that sort of space and ignoring of what's happening somatically or what's happening spiritually. Now, I think that some of the people I worked with were somatically or spiritually inclined, but it felt challenging to sort of add that into the curriculum that was the 30 or 60-day program, right? So in that container, I started doing a lot of research. I was like, there's something missing, in this work with people. We're not getting to what's actually happening. We're just sort of on the surface level, intellectualizing, cognitively understanding. And so that set me out on EMDR. That was my first training where I was like, oh, this is a more somatic oriented modality. I'm going to try this out. That was a really good entry point. I did incorporate some of the EMDR into my work in that treatment center. But even then, because you had such a short window of time, it was like, I could start with that process, but not really see it through. And around that time, too, I was sort of in my office behind closed doors reading all these psychedelic assisted therapy research articles and just orienting myself more towards the somatic approach and alternative ways of healing. And so, yeah, the EMDR sent me on my trajectory. And then the trauma-informed relational somatics is a mainly touch therapy oriented approach, which in my field is sort of, I don't know about that as sort of the general sense, but that played a huge part in me recognizing like, oh, there's so much more to this than just existing with clients on a cognitive or intellectual level.
When you say touch, literally you as the clinician are touching the client.
Yeah.
Interesting. Could you explain that a little bit more? I don't even know how that works.
Yeah, so this modality I learned, I lived for about 4 months in Singapore. I took a break from once I left the treatment center to travel a bit. And so when I was abroad, I found this woman, her name's Natalia Rachel. Shout out to her. She's lovely and amazing. And she had developed her own approach called trauma-informed relational somatics, where she blended like a craniosacral type of therapy. So these are the kinds of touch holds that she's teaching, combined with some hypnotherapy related cues, and then also a very trauma informed and relational style approach to therapy. So this involved some work on massage tables, actually, and practicing many of the craniosacral holds, and also finding sort of the story and the through line related to the trauma, and being able to sit with that, how it shows up somatically, to be able to hold and bring awareness to those sensations without like processing them in the way we would by talking about them. Or yeah, it was just a different entry point into that felt experience. And the main takeaway I've received from learning and going through that program and also practicing that is it's all about relational safety. So on a foundational level, I'm essentially assisting people with recognizing what a lack of safety feels like in their body, then moving forward into recognizing, oh, what does safety feel like? And how can I recognize my body's cues when I'm actually feeling unsafe? And then because we're doing that relationally, it's really powerful because that person will say, I have clients often who say to me, I'll put hands gently or I'll do like a craniosacral hold and I'll say, let me know if that feels safe for you. And their body will be completely bracing and they're controlling their breath and they're like, I'm good. I'm good. And I'm like, well, actually, your body's telling me something different. So I'm actually going to go ahead and take my hands away. And it's a big moment, right? Because then they can feel like, oh, wait, I do feel the ease that came from that and from respecting that. So it moves a lot slower.
Yeah.
But it's really powerful.
Yeah.
Yeah.
So because I'm really speaking to and about, 51% of the population, specifically persons who identify as female, I'm curious whether somatization, with feeling our psychology in our body, is something you see more different manifested in female bodies versus male bodies. Does it seem different? Because I'm thinking about, let me just speak a little bit more about it. I'm thinking about the kind of the integration of and the intersectionality of gender, race,
cultural norms and standards,
all these things. And when I think about, women, when I think of women of color, I mean, there's just all of these boundaries that have kept women in a state of fear and violation. And so I guess I just am curious about how you see it when you're on that end of the table. Have you had any observations or generalizations? And again, these are generalizations I so appreciate.
Yeah. I love this question. It's really helpful for me to reflect on that a bit more. I don't know if I have specific generalizations I can point to in this moment, but I do think what you mentioned in terms of the intersectionality and historically as women, what we've endured from the beginning of time, even up until this point, I feel like, I mean, much of our history has been persecution, right? And oppression. So it'd be silly to think that that wouldn't show up in the room. And I think it definitely does.
Yeah.
I think I see so much of that in sort of like the accommodating or pleasing behaviors, right? Or like what I described to you a few moments ago of this disconnect from soma, from body, and simultaneously disconnect from intuition.
Yeah.
And I think that has a lot to do with our programming and what we've endured as women and it not feeling safe for us to follow our intuitive knowing. And so to survive and adapt, we've learned to, tamper that or minimize that. And that is something that I see that shows up in the room of, hey, actually, I don't really want you to think about this. I just want you to tell me right off the bat what you notice, right? And that being okay.
Yeah.
With men I've worked with, I've noticed more of a fear around touch.
Hmm. Interesting.
Um,
Can you speak more about that?
yeah, I've noticed this with some women clients as well, but with men in particular, and it could also be because of the dynamic, right? Where I'm a female therapist and
Right.
I'm working with a male client. So there's, those sort of preconceived notions around what touch means.
Mm.
And I think so many people only receive touch in a very like hypersexualized way. And in our culture, we're no longer used to sort of receiving this form of intimate touch without it having this other meaning or connotation to it. So I've noticed that in my work with men, there's that barrier that we have to sort of navigate, right? Where it's like, look, let's actually there's an elephant in the room. Why don't we talk about it? I'm going to tell you and be clear on what my intentions are in this space. And I want the same from you as well. And we can talk about it. And a lot of us haven't learned that this kind of touch is okay and can be
Yeah.
really nourishing. And it doesn't have this charge associated with it. If it did, I wouldn't be doing this work on you. And I'd have to be honest about that.
Yeah. Yeah.
Yeah.
You've kind of answered a question I had for you around what's written in your bio. You write that you look into the concept of patterns and beliefs and stories and imprinted by past experiences, societal conditioning, and ancestral lineage. That these things inform you about your clients, and I think you're speaking to that. All of these beliefs and stories we have around about touch, certainly ancestral lineage around being a woman and the years of persecution, societal conditioning for sure. And
Yeah.
I'm glad that we've just brought it out to our audience because, again, it might seem obvious to those listening, but for many, it's just not. Again, I'll have women come into my office and they'll start talking about a particular conflict in their life. I'm making something up. Like, someone who comes in and says, my boss is a pain in the neck and I just feel so frustrated. I'm angry. I'm sad. And it's it's very black and white in many ways. And then when I start to ask about the boss, and I don't pretend to be a therapist, but I'm curious. So I ask about the boss, and all of a sudden it becomes a storyline that so reflects their father or so reflects their ancestral storyline, and they've never put it together. And that's okay. I mean, that's the role of someone like
Yeah.
you to help them weave those stories and understand those stories. So yeah, again, for those listening, often what we're worried about, feeling depressed about, what we're feeling anxious about, and we might say, I don't know what's going on. I don't know why I'm feeling anxious. That anxiety may be tapping into something much deeper than what's obvious on the surface, right?
1,000%.
Yeah.
I couldn't agree more.
Yeah.
And I think something worthwhile to investigate.
Yeah.
Like
Yeah.
with anxiety, I think, sort of the main model and approach to that in a lot of mainstream clinical work is like, what can we do to cope with that?
Yes. Yes.
And I'm more in the sort of headspace, feeling space of like, actually, what would it be like if you were to get curious? Oh, perfect, kind of curious. What would it be like for you to get curious and sort of lean into that? And instead of this like, woo, you're kind of like,
Yeah.
you
Peering into
know,
that chasm. It's
peering into that because
it's
there's information there,
Oh my
really
gosh. Yeah.
valuable.
Yeah. And scary and hard
Yeah.
and makes you cry, but all of that stuff is so, so important. So I wanted
Mm-hmm.
to ask a question around trauma. When I was a
Right.
kid, so I'm 63. When I was a kid, I don't ever remember, and it may just be my memory, but I think this is true. I don't remember the word trauma applied to
Mm.
anyone. Really. I mean, it wasn't a word. You might have said somebody was sad. You might have said, I might have heard my mother say, like, one of her friends was depressed. But
Mm.
trauma wasn't a part of the lexicon. And now I hear it all the time, particularly from
Yeah.
people who are younger than me, where they talk about trauma. And I wonder, is this just it's one of those chicken and egg phenomena? Are we just better at like understanding what trauma looks like and feels like and is and can define it better? Is it a fad? Has science informed us that so much of what we experience in mental health is about trauma? I just worry about kind of the over medicalizing of normal emotional responses to stressors, and
Yeah.
that this will kind of, I don't know, bear with me, like undermine human resilience in the face of adversity. Like, how do we
Sure.
differentiate normal human dynamics, possibly benign childhood experiences, for example, from
Mm.
trauma? So maybe I'm being a little sensitive about this word, and I don't. I guess
Mm.
I am a little sensitive because I hear it so much, and I just
Yeah.
wonder: are we running away with it in a way that's losing touch with what it really means? Are we creating a disadvantage for younger people as a result of, like, oh, you're in trauma and therefore they're not developing grit? Am I being clear?
Yeah, Amy, I think it's a bit challenging to be clear on this.
Thank you. It is. It is.
Yeah,
Yeah.
I will say that I've also noticed, what it is that you're talking about, just sort of like this trend, right? Trauma is a lot of what we're all talking about these days. And, before I share my take on some of that, I am curious sort of what your thought process is, right? Like generationally speaking, this wasn't a topic of conversation. Like this word wasn't in the lexicon. Do you think that was sort of based on like the level of knowledge and understanding we had at that period of time, or the lack thereof? Do you believe? Because I have a really hard time separating what it is that we're seeing or what you experienced previously from like our environment and our generation.
I think it's complex, clearly
Yeah.
complex. It's interesting. I was just reading a novel about women in the Vietnam War. And
Hmm.
there weren't a lot of women in Vietnam. They were nurses mostly, and there were some other jobs, but mostly they were male-bodied soldiers. And it was
Mhm.
a story about a woman coming home, and basically, like many of the men, were just told, forget about it, honey. You'll get over it, find a man, fall in love, forget about it. And she kept looking for help, and everybody kept saying, first of all, oh, there were no women in Vietnam. Like, well, no, she was there. She was a nurse and definitely was experiencing PTSD. So, I
Mm.
think that and that was true for a lot of NAM vets, that the understanding of PTSD was really limited at that time. So, yes, I
Yeah.
think there's a certain amount of like the wave of science, the wave of understanding of the human
Mhm.
psyche, the human body, the the
Mhm.
the 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 way in which we name these phenomenon. Yes, I
Mhm.
think that when I was a kid, remember, it was also, post World War II. The baby boomers were doing great. My family, there was some conversation about Holocaust survivors, and that was kind of that defined trauma, and everything else was kind of not so much. There certainly was no discussion in my family of origin about violence against women. I mean, none of that was
Mhm.
said out loud. So I think part of it
Yeah.
was just the inability to put voice to it. I think it was
Mm.
combined with a lack of education and understanding.
Yeah.
And there was also, I can only speak to my family. Like, my mother was like, grin and bear it, baby. Like, go
Mm.
outside and play, and I don't want to hear about it. So there was a lot of
Mhm.
just her own defensiveness against anything that was emotionally triggering and hard to deal with.
Yeah.
So it's so hard for me to know, but I must admit I have some judgment, and
Mm.
and I apologize for it, and I feel a little shamed by it, around what feels like a lack of resilience and grit in some of the younger folks out there.
Okay.
And again, that may just be I'm told by my family members, oh, that's just your mother talking. And that's just
Hmm.
a, part of the script that I just heard from so many generations of women in my family. And maybe it is.
Yeah.
Maybe it is.
Well, maybe
Yeah.
that's part of it. I mean, definitely worth investigating. I guess what I'm picking up on as you describe it and talk about it a bit more is like I feel like sometimes the word trauma can be placed onto something to avoid touching it in a way,
I
right?
agree. Yep. Yep.
Right. Where it's being used so often, where it's like, well, that was traumatizing, right? Or that is a lot of trauma. Or even the use of like, I see often like the labels of personality disorders. Okay, they're clearly a narcissist, right? It's like, I think we have to be so much more mindful, right? Because that is just slapping a label onto somebody to try to explain, I guess, how they're making you feel or how they're influencing you. I get it. It is in the DSM-5, and I think, it exists on a spectrum, and I do think that is present in the world. But even that is a trauma response, right? And so I feel like as we talk about it, it's more of like, okay, trauma is being thrown around everywhere, but it's sometimes used as a way to just be like, cut it there,
I think that's what
right?
you're tapping into for me, is that it became
Yeah.
it's like the world of allopathic medicine where everything fits a diagnosis and a code. And I see it as such a limited way of looking at a human being's experience. And
Yeah.
so I mean, I really deeply respect people's experience with trauma, with hardship.
Hmm.
And I certainly also respect people's experience around illness and challenging experiences with their body,
Yeah.
in that allopathic arena. So I guess it's part of what I'm speaking to. So thank you. You're really clarifying it for me. Is just the way in which we put band-aids on these issues and don't
Yeah.
ever uncover the band-aid. We just keep applying the band-aid, or we just keep giving the medication. We just keep writing the script. And
Yeah.
there aren't enough folks really out there saying, let's peek on, even if we just lift up a corner of that band-aid,
Hmm.
just a little corner right at the moment. Can it demonstrate, can it illustrate, can it reveal something about that pain you have, that experience with headaches, backaches, fear experiences, et cetera, et cetera. So yeah, I think that
Yeah.
that's part of what's going on for me. Yeah.
Well, and I'm glad we could, get into that a little bit.
I'm so glad you're
I
on the other end
also
here.
I want to add a few things on trauma, just speak to a couple things here. I think also worth mentioning, and what I've shared with you previously, right, is like I don't see a separation between what's happening with us individually and collectively and the environment and point in time that we're living in. And so I do think that over time, historically, and then sort of ramping up into where we are now, the system in which we live is indeed oppressive for so many of us. I, as a white woman, will not face the same level of oppression as some of the other people I share space with in Los Angeles, right? So I always need to recognize that. But I think, we talk about sort of like the heteronormative structure of things, patriarchal issues and systems, capitalism. Like we're sort of existing at the peak of some of these things. And that in itself, I do find feeds
Mm,
trauma.
mm,
And so I do feel like more of us are feeling that because of the system and culture that we're living in, and also historically what we're carrying with us. So I think we live in a traumatized culture. I do.
yeah.
And I know that word is thrown around quite a bit, but I'm using that word to sort of point to the oppressive systems and institutions that we're all a part of and engaged with right now. And then I also wanted to touch on too this definition of trauma that I really like. It's by a physician, Gabor Mate. Are you
Mm,
familiar with Gabor?
I am. Mm-hmm.
Okay. I'll read a little bit and then speak to it. So, in his conceptualization of trauma, he defines it not as the actual event itself, but as the emotional, psychological, and I would add actually spiritual impact the event has on a person.
Mm,
So he talks about how that when trauma occurs, it's when we're unable to process overwhelming experiences, right? We don't have the resources, we don't have the support, we don't have a way of getting out of what it is that we're experiencing. And so that can often lead to long-term emotional, mental, physical, spiritual challenges. So he also describes how trauma can exist on a spectrum. You know, one person can have exposure to bullying and not develop, a traumatic response related to that, or as much of an impact,
Right.
right?
Right.
Versus someone else who endures the same thing and it's completely different for them.
Yeah.
So there's a lot of layers in terms of this, but I also hear what you're saying, right? Is like, as long as we're not using that term to sort of put a band-aid on everything, and we're at least peering under the surface and being like, okay, well, that's activating for you. And instead of take this or avoid this or just cope in this way, we're like, no, let's go into that in a way that feels safe. We're not going to like throw you in the deep end, but we are going to like lift the curtain a little bit or lift the band-aid a little bit
Yeah.
and see what's going on.
Yeah. Great.
Yeah.
Great. Thank you. I'd like to pivot because I want to make sure we
Mm-hmm.
talk about ketamine. So I guess if you would, for the listeners, can you just, tell us what ketamine is and remind us, is it considered a psychedelic medicine?
Yeah. It's not medically considered a psychedelic medicine. Historically, it's a dissociative anesthetic. And I'm not one for remembering the medical sort of neuropharmacological terms. So I'll just tell the audience now, you're not going to hear it from me about the NMDA receptors and glutamate. I tend to just, enjoy speaking about the relational component and what I've seen in this
Great.
work. So
Great.
historically and how it's been labeled as this dissociative anesthetic, many people would argue that it's not a classic psychedelic, and it's technically not in, chemical medical terms because it's not acting on the same receptors as some of the more common psychedelics.
Like LSD, for
Um,
example, for those listening.
yeah, like
Yep.
LSD,
Right.
psilocybin, DMT.
Mm-hmm.
So with ketamine, it's interesting because I actually just got back from the Psychedelic Science Conference in Denver.
Oh, great.
And this was something people were talking about of like, can we or can we not call ketamine a psychedelic substance? And I think we can, because at higher doses, let's say via intramuscular injection, or even sometimes a higher dosage with lozenges, it can induce a psychedelic experience in the sense that there is, a separation from ego, sort of like a dropping into a deep meditative state that allows for a bit more spaciousness and observation of your internal experience. And sometimes people have mystical experiences as well that sort of fit and track with the psychedelic domain. So, in my experience with it and in working with this medicine with clients, I'd say, yeah, I would put it into that category.
So, to remind everyone listening, ketamine is a medicine that's been used for anesthetics for, I think, since the 1970s, and it is FDA approved for that purpose. It's a Schedule 3 drug. Approved. I'm reading a note I made in 1970. So it's out there. We know it's out there. It's a rather newer substance, however, in the realm of the work that Taylor does in the world of psychotherapeutics. And so,
Mhm.
how did you like? What brought you to the world of ketamine? What brought you to the world of I'm going to learn about this and apply it? And I'd love also for you to share an experience with a patient without obviously sharing personal information. Like,
Mhm.
what have you experienced giving ketamine and seeing a transformative experience with somebody that you could share with us?
Yeah. Yeah. Wow, so much to touch on
I
there.
know. And, but you don't have
Um,
to go all those. I asked you a lot of questions all at once, so bear with me. I guess, people want to know why does Taylor work with ketamine? Why?
Yeah.
There's so
Yeah.
many other things out there. Why ketamine as one of her tools?
Yeah. Well, I've had this fascination with altered states of consciousness, not only through, chemical agents and plant medicines, but also through breath work, through, peak experiences. And so that sort of segued me into diving into this a bit more. I was seeing a lot of the research come out around like end of life anxiety with psilocybin out of John Hopkins. And then more ketamine research started being published, and I said, wow, this is so interesting. And so, like anything else that I would do in the room with my clients, I had to see for myself. So that's one thing, I'll let the audience know, and most of my clients know already, is that if I'm bringing something into the room, it's because I've had my own experiences and relationship with it, and I've charted some of the territory ahead of time. So I had my own experiences with different types of medicines and found a lot of value in what I was uncovering. And I said, wow, this could really serve as a helpful adjunct to psychotherapy. And that's sort of how I see it. I see it as an adjunct. I don't see it as sort of like we're going to give people ketamine. There's these ketamine clinics, right, that are opened using mainly IV, intravenous. And I do think that does have some value. Like there are properties of ketamine that really help reduce symptoms of depression and anxiety. There's a chemical component to that. But I really believe the psychotherapy piece combined with the altered state of consciousness induced by ketamine is what's most powerful. So why do I work with ketamine? Well, I think it's a medicine that opens you up to what already exists within you in a way that doesn't feel, some people may argue with this because, there are challenging ketamine journeys and experiences. But for the most part, I've seen it take a rather gentle approach with people where, your ego, your default mode of thinking, the sort of automatic, this is the way I see the world through my set of beliefs, the familiar thought loops, your sense of who you are in the world as Taylor, as Amy, that volume gets turned all the way down in a ketamine experience. And so when that gets turned all the way down, you have so much more access to who and what you really are. And in a way, you sort of become this witness or observer of your experience because you're not just solely in the egoic structure. And so sometimes I've noticed that in my work with clients, ketamine won't solve all their problems, but it'll say, take a look at this. Okay, now take a look at that. Right? And for others, sometimes it'll plunge them into the interconnectedness of all things, and they come up and they're like, everything's connected. I don't know why I didn't think otherwise. I'm like, I mean, I don't know if that would have been years of psychotherapy or what, or we would never get there. Right. But this piece where it's like, hey, check this out. Hey, check this out. Sort of leaving you some of the crumbs, right? Of like, there's something here. Because when you turn down the dial on the ego, your defenses, your guards come down as well. So you're open to receiving what it is that's there. And that's what I found most powerful, right? Is you connect that with the psychotherapy piece. Hey, what did it say to look at? What was your attention and energy directed to? Oh, it was this experience I had when I was, 7 years old, and I don't really know what it means, but like maybe there's some, and then that's part of our integration process of like, okay, let's explore that a little bit. What is there? And so I just find it's hard sometimes in the therapy room to get past the defenses, the mask, the guard that we all wear in the world, which is protective in nature. It makes sense. But when it's just me and someone else talking, I can't always get there. And neither can the individual, where it's like, no, I actually can't turn down my mind because it is running wild and is preoccupied with so many different things. So this offers like a 40 to 50 minute break
Mm.
And that's the other wonderful thing about ketamine is you're not on a journey for 6 to 8 hours or 12 hours. You're you sort of have a round trip ticket, 40 to 50 minutes, and you're back.
Mm.
You're back. You're back into like, oh, I'm Taylor. I'm here.
Yeah.
I can go use the restroom.
So,
Even though I was like laying down immobile, I am now back and can go do that.
so, I want to point out to everyone listening, what Taylor is definitely pointing out is that one, there's science that's demonstrating that ketamine can be helpful for people who have been told that they have major depression, anxiety, trauma related issues. But that the way it works best, safest, most efficacious is integrating it with therapy. That it's not about going and getting ketamine off the street and doing it over and over and over again, which, there's, as far as I know, there's no science on that experience. And maybe you could speak a little bit to that. But
Yeah.
I always like the idea of doing something like this, if you will, under the watchful guidance of somebody who is hoping that this journey is going to bring you to a place of insight. And sometimes that insight has to be, in a way revealed with conversation.
Yeah, and I think there's something that's coming up for me around that brings up, a few of my qualms with the psychedelic space. And I think most importantly, the psychotherapy aspect of it, the most important piece of that is the relational piece. Because I'm never coming into the room, or, sometimes I fall back into this, but I really try to be mindful. I'm not an expert. Like I've had education, formal education in psychotherapy, but I'm a human standing along another human, and I have my shit and they have theirs too. And so I don't want to speak to, the ketamine experience or plant medicine experience being exclusively only for people who have access to therapy. That's the
Interesting. Okay.
piece where I feel a bit like, yes, I think this work is very relational and there's so much value, but it's also not accessible to
This is
so
the
many
problem.
people
Yeah.
because it's so expensive to be working with a prescriber and then to be paying my fee, which is typically, longer. And I try to create some sliding scale options around that, and also create group experiences that are more affordable for people who just want to try it out first.
Yeah.
But yeah, even as you talk about it and sort of reflect back what I'm sharing, I'm noticing that come up for me of like, I don't want this to become like, you can only experience the power of this medicine if you have a therapist.
Okay. Yeah. Yeah.
I feel like there is a lot of information out there in terms of drug and chemical education and harm reduction strategies that, if done intentionally and in a supportive framework, people can still benefit from this.
So intentional and safe. That's what we're speaking about. That
Yeah.
it's listen, anyone can, I'll use the word abuse, anything, in terms
Yeah.
of any medication, whether it's a psychedelic or whether it's an antihypertensive medicine. There's risk associated with any of these medications. So, as a physician, I guess I just want everyone out there to just be safe and intentional. And
Yeah.
I'm glad to hear there are resources for people to learn about ketamine that may be apart from a therapeutic environment, because you're right, it's just not accessible to everyone. And if the medicine can reveal something for someone that helps them move through into a healthier space, I'm kind of all for it. So
Yeah.
tell
And why
me,
do I have to
yeah.
be the gatekeeper of that.
Yeah,
Like
that's
that doesn't make
interesting. It's
sense to
interesting. You're
me.
right. You're right. Which is a conversation that aligns itself with medical autonomy and body
Yeah.
autonomy, which is kind of outside the scope of our conversation today. But
You know?
but it's all about that. It's all about I want to make a choice that's right for me,
Mhm.
and I guess I would just say to the audience out there, because I want you to be healthy and intentional about your activities. Yeah.
Mm.
So what happens when someone comes in? Do you give ketamine by mouth? Is it a lozenge? Is it an IV? I mean, I know there's a lot of different ways to give it. So what happens when a
Yeah.
patient decides, who's been seeing you, and and she have decided you're going to try this? How does it go down? What
Yeah.
literally kind of happens?
Yeah, well, it varies. I mean, sometimes I have clients we've already have an established therapeutic relationship for
Mm-hmm.
some time, and we
Mm-hmm.
choose to bring in the ketamine.
Mm-hmm.
So that would be different than someone sort of purely seeking me out for ketamine assisted therapy. So I'll
Got
go
it.
with that.
Mm-hmm.
So if someone's like, I'm consulting with someone and they say, "Oh, I found you online. I want to do ketamine assisted therapy." I say, "Great. Let's schedule sort of your intake assessment so I can get a better understanding of, your context, your life experience, what's bringing you to therapy, why you're seeking CAP. And then also I'll do some light screening
Mm.
there as well because there are some contraindications with ketamine assisted therapy.
What are they? Could you
Um,
tell us?
yeah, there's, sort of like a warning flag around anyone who's had recent symptoms of mania
Mm.
or psychosis. These are sort of two of the major flags that I look out for. Someone who's been diagnosed with bipolar disorder and who has experienced mania in the past won't immediately be, you know, not considered. I mean, it's just a matter of the timing and sort of what support is in place and what that looks like for that person. Psychosis is one that many people in the field are scared to touch when it comes to this. I think there's been some research of like this can actually increase the intensity of those symptoms for people in that state. So those are questions I'll ask. And then also substance abuse history is pretty important.
Mm.
And also suicidality. So those are some main points I'll touch on with someone as I'm getting to know them and exploring that together. And part of the preparation process, they'll also meet with the nurse practitioner I work closely with, who will do a full medical evaluation because there are also some medications that just need to be considered
Great.
for this kind of
Yeah.
work. But then, I tell the client we'll have a series of preparation sessions, and that could range from 3 preparation sessions to 10.
Hmm.
It really depends. And I'm very upfront with people off the bat. Like the trust and rapport that we build and the intention behind this work, that all together is going to have a big influence on your experience. And the education I provide ahead of time, the development of tools and strategies for how to navigate maybe challenging or scary experiences. These are all things I'm doing with people before we even get to the ketamine work. And then we'll, decide on, okay, do we want to work with lozenges or we want to work with intramuscular injections? Lozenges are valuable. If someone wants to start sort of low and slow, I'll go that route so they can get a feel for what ketamine feels like. And at lower doses, we can actually still engage in psychotherapy. We can be talking, right? So it just has this subtle effect of sort of letting down your defenses, your protective mechanisms, so that we can have a more open conversation. You can use the lozenges to access maybe a more psychedelic experience, but what's a bit of a gamble with them is that everyone metabolizes that differently, and it's not sort of guaranteed what dose is going to work. So there's a lot of experimentation that comes along with that as well. It may take a little bit of time. The other route is the intramuscular injection route, which induces more of a psychedelic experience. This is where, I create this sort of nest for people with a cozy blanket, a floor cushion, eye mask, noise canceling headphones. I curate playlists for every single one of my clients. I
Hmm.
love doing that. Music has a huge part in this. This could be a whole other episode, honestly. And I usually like to do a series of, anywhere between 4 and 8 ketamine sessions, usually once a week, but it really varies. Sometimes someone will have an experience and we spend 2 weeks integrating what came of that
Mm.
before we even go back into it. So there's a general like standard of care that's been measured in research that's been effective. But for me, I'm all about the relational style. So I'm always checking in with someone I'm working with. I'm saying, like, okay, is there more that we're integrating from this? Would it be better for us to have another session and conversation or see what this is like in practice before we go back? So it's always a conversation, always checking in about that. And again, taking myself out of the expert chair and being like, how do you feel about this? Like, how is it landing with you? What's digesting, right? We need to rush into another session or, you know, can we start to instill some of these practices and sort of see how it goes? So,
I love that. It's so clear to me based on science, experience, observation that building community, being in relationship with another human being is a part of healing from like every perspective. And,
yeah.
Whether it's longevity, whether it's healing after cancer or during cancer treatments, in the dying process, that even just overall health. When we talk about overall health, it's not just exercise and eating well, but it's being in relationship. So
Yeah.
you're bringing this forth, and I think that's so important. And it's again, for everyone who's listening, I'm not talking about you have to have 30 friends. I'm talking about being in relationship perhaps with one person, whether that's a therapist or a friend or the person you ride the bus with in the morning to work, just someone with whom you are sharing your story with, which is, of course, the purpose of Gyno Curious, is that I want to share our stories because we are in a challenging world and time. And so often what helps us move through it is saying, oh, wow, she's going through that too. I don't feel quite so alone. And that, I'm not so weird. I'm not the only one who thinks that. All of these narratives that we have that, run deep grooves in our lives, that we believe we're alone and unheard and not seen, etc. It's so nice and so imperative that we know we are heard, that we are seen, that we are in a room with someone who truly cares. And I'm going to think a lot about this concept of, expert. It's interesting that you pointed that out because, physicians are always, they're so high on their expertise. And,
Yeah.
and,
Yeah.
it's, I get it. I totally love knowing all that I know. At the same time, in the room, yeah, it's really important I know my science, but so much of what I do is just looking someone in the eye, a gentle touch, and saying, I hear you. I hear you. And they don't teach that in medical school,
I
So
was
it's,
just about to ask you that
yeah,
actually.
no,
Like,
no, never,
no.
never, never, never. So you're bringing out something so relevant, because the medical system, as I've spoken about so often in Gyno Curious, is in such a state of dysfunction, and people are looking for ways of healing that sometimes have to fall outside the conventional medical arena because it's just not taking care of them, or it's taking care of a part of them and not enough, or the side effects of a medication are just too difficult, so they're looking for some alternative. And I'm all for it, as long as, again, as it's safe and intentional, and I guess safe is the best word I could use.
Yeah.
So yeah. So again, thank you for kind of mentioning that, because expertise has a place. It doesn't define it
Yeah.
all. Yeah. Yeah.
Yeah, definitely. And that's not to minimize the amount of time, energy, work, effort that is spent in getting to where you are, right?
Or
Or
you.
in
Yeah.
earning
Right.
my credentials,
Right.
right? Like
Right.
there is
Right.
value to that. But if that acts as a barrier to actually attuning to the person in front of you and is sort of another ego trip, then that is going to greatly impact your ability to connect with and genuinely listen to and attune to the person who's sitting right across from you. And I think that that's, my biggest takeaway right now from doing this work is like, yeah, I could know the theories and I'm trained in all of these modalities, really beautiful, great. Sometimes I use them and sometimes I throw the whole book out the window, and I'm like, I just need to be a human right now in this room with another human. And the skills of attunement have actually been much more valuable to me than the EMDR or, the knowledge, right? It's like, it's great that it's there, but when I'm in the here and now with someone who's sitting across from me, it's not the most important thing, actually.
Yeah. It's so interesting. It
Yeah.
just struck me that expertise can sometimes be, in a way, I'm just reiterating what you just said. It's like expertise can be a shield, which
Yeah.
blocks transfer
Yeah.
of information either way, or it could be just a scaffolding upon which the relationship is developed, the healing
Yeah.
modality is embraced, the healing happens. So I hope for all of you listening that you can find a practitioner, a healer, a person who can listen to you, that, rather than holding up a shield, is just providing you a scaffolding upon which you can tell your story. Yeah.
Yeah.
Thank you. Is there anything else that you would like to add before we say so long?
Oh, well, I just want to say thank you for having me here. I'm so grateful and feel so honored to be on this podcast. I know you and I hit it off right away when we met, so I'm just excited to be back together and having these great conversations. And yeah, I'll just say that, for any of the listeners out there curious about, alternative styles of healing, whether that's through ketamine or other psychedelics or plant medicines, I'm always up for having a conversation, even if it's not a full session, but you just want to ask some questions and learn more about it and see if there are any practitioners in your area. Please, maybe I'll ask Amy to share my contact information so that people listening have it. I'd be more than happy to have a conversation about that. And then also just a reminder too of like, I feel like, there's so much we can touch on related to this. It's sort of in the arena of when I talk about this expert persona. I fully believe that we all have access to our own intuition or knowing. And something I just want to share with anyone listening is that if you feel disconnected from that or feel like you can't hear that, it doesn't necessarily mean it's not there. And I hope that as you go along in this life and human experience, you find people along the way that, you know, don't claim to be the expert on your experience or can claim to heal you, but rather open you up to your own innate healing intelligence because it's there and it's powerful and it's who you are. So yeah, I just wanted to throw that in there at the end.
Well, it's
Yeah.
great because my outtake you'll hear soon enough, and it's all about that. So I like to finish my conversations with just asking about pleasure. So when you are not healing others, what do you do for yourself for pleasure, for joy? One thing. What would it
Okay,
be?
fine. Only one?
I know,
There's
I
so many.
know, I know.
Okay. Lately, I've been teaching myself to DJ.
Oh, that's great. That's great. All righty.
Yeah, it's
So,
been so much fun.
okay. So, if somebody, why don't you quickly give the audience, how would they contact you, or how might they hear you spin music? How would they
Ah,
access that?
okay. Well, my DJ sets are not online yet. I'm
Okay.
still learning,
Great.
and right now I'm at the phase where I'm doing birthday parties and people who are sort of connected to me being like, you want experience, come do this.
Right.
So I'll have to keep the audience informed when that becomes more official. But contacting me, I work for a group psychotherapy practice called Flourish Mindset. We're based in Los Angeles. So if you go to the Flourish Mindset website, which I believe is just www.flourishmindset.com, you can find my bio and my page there.
Great.
And then also my email address. So that's just taylor@flourishmindset.com. So
Great.
anyone can reach me there.
Great. And I will include that in the show notes. So thank you. Thank you for joining me today. I'm so pleased that we learned more about ketamine and about your work and your beautiful insight into helping others heal. Thank you.
Yeah. Thank you, Amy. Yeah. So great being here.
And thank you to my co-producers, Jen Hammoud and Matty Rosenberg, and to my editor, David Hoffman. Until the next episode, please be well. Listen to your instincts and intuitions. They are the greatest of teachers, not to be ignored. And Taylor did not tell me to tell you all that. That's my outtake. But I also want to remind listeners that this podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed here today. The information on this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions. Thanks and be well.